use this to show you the distribution of cases by ages, so that you can see from ages 20 through 60. That's where the vast majority of cases are. But this chart shows you the distribution of deaths and how dramatically that is skewed towards the older population. This is why there's been so much emphasis placed on the 75 plus group and the 65 plus group, is to reduce the mortality. This is another chart off of our departmental website. And by the way, we have some wonderful people, our epidemiologists and all those folks down in public health that put together our dashboard, just do a great job. But this shows you the cases by ethnicity. And what's dramatic here is how the white population has significantly less cases, and all the other ethnic groups are higher. But what's counterintuitive is if you look at deaths, the white population is far higher. And I haven't seen studies of this, but my sense is that the white population in general is wealthier, live in neighborhoods that houses are spread apart, they're not crammed into apartments, and they have access to better health care. So that's why the deaths, in my opinion, are much less for the white population. If you look at the Latino, the Hispanic population, theirs is lower. I would bet that's because they have younger families with more children, less likely to die from the disease.
I'm not sure I understand. You said the white population is more wealthy, but they have more deaths.
I'm sorry.
Because
they're more wealthy, because they have better health care, they're less likely to die from the disease.
But they have the most, but you're saying they have less deaths by when you compare it with by population?
I can explain that. The reason is the increase in deaths by age.
Right.
And if you were to look at ours, you see that about 80% of our cases are over the age of deaths are over the age of 65, and predominantly Caucasian. And a lot of that is because of the deaths in the long-term care facilities. About 50% of our deaths were in long-term care facilities.
Oh, okay. Supervisor Cerna.
Thank you. I want to understand what the muted percentages are.
I'm sorry.
So
the muted percentages are from the chart. That is the percentage that you see in that pie chart. The one on the right is the general population. So the general population of whites in the county is 45% to 51% of the deaths. I'm sorry.
Gotcha.
And the other ethnic groups, Asian, Black, Native Hawaiians, and American Indian, are all higher than you expect. The one that's really troubling is the Native Hawaiians and Pacific Islanders, where their ratio of mortality is twice what you'd expect from their population. At any rate, this gives us the impetus to get out there to those vulnerable communities and populations to get them immunized as quickly as possible. This is where we are now. We're in phase 1B.